Hi everybody, this is Chris Russo from Paramount Retirement Solutions, and we're about to get started here with this Understanding Medicare webinar. Hope you have a piece of paper and a pen handy so you can take lots of notes, or maybe have Microsoft Word open and get ready to take lots of notes as you watch this webinar. I hope you find a lot of value in it, so let's just get started. Hey, I'd like to welcome everybody to the Understanding Medicare webinar. Just letting you know that this webinar is a recording, so you can feel free to pause it, fast forward, rewind it, and replay it if you need to. Some of these concepts are going to be somewhat straightforward, you might be familiar with, but a lot of these Medicare concepts and some of the amounts that we're going to be talking about, you're going to want to write down, and they're going to be a little tricky to understand. So yeah, definitely use this resource and go back and pause things and rewind things as you need to. This webinar is specifically going to be for folks that are turning 65, getting Medicare for the first time. It's going to be who it's specifically geared toward. It's going to be broken down here in 5 different parts. So first of all, we're going to look at actually signing up for Medicare, kind of what you need to do to make that happen. And we're going to talk about what Medicare covers as far as what the different letter parts of Medicare like Parts A and Part B cover, and what they don't cover as far as where the gaps are, you know, what your responsibility is for the different cost shares and what Medicare doesn't cover. The third part, we're going to talk about Medicare supplements with standalone drug plans. When we're looking at what to do about the gaps in Medicare, you're going to have 2 main choices. Basically, all the stuff you're getting in the mail, all the phone calls you're going to be getting, it's all going to have to do with the secondary insurance, and they're all going to fall into one of 2 main categories. Either Part 3, we're going to talk about Medicare supplements with drug plans, or you can go the route where you get a Medicare Advantage plan. You can either go down the route in Part 3 or go down the route we're going to talk about in Part 4, but you can only go down one, I call path or the other. It's going to be kind of evident when I show you the chart that you can, kind of have a fork in the road where you can go down one path or the other. And then Part 5 is going to tie everything together. It's going to show you the pros and cons about going down either the path on the left or the path on the right. And then it's just going to be all about how to pick the right plan for you and then how to get the best price for it. So the goal of this webinar is really just to educate you on how Medicare works, how supplemental insurance works with Medicare, and then help you be able to make, the best choice that you can about what supplemental insurance you decide to go with. So this webinar is going to be for folks that are turning 65, getting on Medicare for the first time. It's also going to be for folks that are older than 65 and still working and still covered under a group plan. And then, because once you do retire, or once your spouse retires from that group plan that you're covered under, you then do need to get Medicare and sign up for your own supplemental insurance. If you or your spouse are still working as you're coming up on your 65th birthday and you're going to have an option to keep that plan, go ahead and click the link to the video underneath this video. There'll be a link right down below. It's going to take you to another video where it's going to go over the thought process and the things you need to consider if you do have the option to be covered under a group plan. So you can watch that video. If you figure out you do need to get Medicare with your own insurance, you can always come back to this video or just keep watching to figure out what's going to be involved getting on Medicare and your own insurance separate from what's being offered through your employer. Part 1, talking about signing up for Medicare. Something you may or not be aware of. A lot of folks aren't. Going to be a relief to you, but if you're drawing any type of Social Security income, whether it's from your benefit, from your spouse's benefit, you're going to be automatically signed up for Medicare. So it's going to be one less thing that you're going to have to do. You're not going to need to go down to Social Security or to call them. You're going to be automatically signed up for Medicare. Your effective date is going to be the first day of your birth month. So let's say you turn 65 in October, then your Medicare effective date is going to be October 1st for Part A and for Part B. The only exception is if your birthday is on the actual first day of the month. So if your birthday is on October 2nd, it's going to start October 1st. If your birthday is on October 30th, Medicare will start for you on October 1st. But if your birthday is on October 1st, then Medicare actually starts the month before. So Medicare would start, in your case, in that example, on September 1st. And there's that exception. You typically get your Medicare card in the mail about 3.5 months before your birthday. So again, if your birthday is in October, your effective date is October 1st. 3.5 months before that's going to be sometime in mid-June. So start keeping an eye out in the mail for your Medicare card that you're going to be automatically signed up for. Keep an eye out in the mail for it starting in the middle of June. So if you're not drawing Social Security going into 65, there's going to be 3 different ways that you can sign up for Medicare. Once your initial enrollment period starts, that initial enrollment period starts 3 months before your effective date. So if your effective date is October 1st, anytime after July 1st, you can sign up for Medicare. The quickest and easiest way to sign up for Medicare is going to be through Medicare's website at medicare.gov. I've gone ahead and I've recorded several minutes of a little demo in where I've gone into the website and kind of shown you how to get started. So take a look at that clip now, and then we'll come back to this live webinar. So enrolling online is actually going to be the quickest and easiest way to sign up for Medicare, and we can do so at medicare.gov. I just wanted to take you through the first few steps here to show you how to get started. So if we click on the button here, Apply for Medicare, this green button here on the left side of the page, that will take us over to the Social Security Administration web page. And there's a lot of great resources on this page. One of them is this link to apply for Medicare in less than 10 minutes. It's just a quick several page document that kind of shows you how to go through the process. If we scroll down in the page toward the bottom, what we want to click is to apply for Medicare only. So we're going to do that. Click on that link. This shows how to get started. There is a link here that tells you what information you're going to need to get started. Basically, it's just going to be things like your birth certificate, information about existing coverage you have through an employer or a group plan, things like that. So if we just go to start a new application, and let's just say you're applying for yourself, we'll click that option. You enter one of the 2 options here, whether or not you're blind or visually impaired. Let's say that you're not. We're going to click that button and then hit next. And that's about as far as we can get here without entering your personal information. So that is how to get started. Another way you can sign up for Medicare, if you're not comfortable using a computer, you kind of want to do things the old-fashioned way, give Social Security a call. The phone number is listed there at 1-800-772-1213. You can talk to a live agent. They can get you enrolled into Medicare. The only downsides are that you might be on hold for a half hour or 45 minutes if you call in, depending on how busy they are. And the process of signing up could actually take about another half hour. So you very well could be on the phone for an hour or more if you wanted to sign up this way. The third way you can sign up is to go to your local Social Security office, to actually go into a building and talk to a real person and, looking into their eyes and kind of doing things the old-fashioned way. A couple things to keep in mind if you want to do it this way. First of all, make sure that office is still open. Social Security has closed a lot of these actual brick and mortar locations. So make sure they're still open and make an appointment if you can. Making an appointment will cut down on your wait time by a lot. Otherwise, if you can't make an appointment, your best thing to do is to probably go during the middle of the week. Go when they first open. Try to go at a time where not a lot of people are going to be there, so you don't end up, kind of waiting in line for an hour or two. And then kind of going back to, if you do have the option to be covered under a group plan, when you're now going to be Medicare eligible, the best thing to do is to check with your HR department, the benefits department of that employer. See if they require that you sign up for Medicare Part A and or Medicare Part B. They're going to be the best ones to tell you. Generally, your rule of thumb is if you don't sign up for, if there are more than 20 people that work for that employer, you're not going to need to sign up for Part B most likely. You won't be faced with a penalty later, but it's going to be best to talk to whoever kind of is in charge of that group plan and say, look, I'm Medicare eligible. What should I do about Medicare? Should I sign up? Should I not sign up? Again, that video that's listed below will kind of go into a lot of the ins and outs of really the things that you need to consider, but definitely check with your HR department. If they say you don't need to sign up for Part B, it's generally going to be best to not get Part B because that's going to save you money every month. That's going to be kind of obvious as we talk about the different costs of Medicare here in a second. But if you are drawing Social Security, like we talked about before, how you're going to be automatically signed up for Medicare, then you're going to want to opt out of Part B. You're going to want to let Social Security know, hey, I don't want to have Part B. This is going to apply more to folks that are the spouse of someone still working rather than someone still working, because you're going to be more likely to be drawing Social Security. But if you're drawing Social, you don't want Medicare Part B because you're still going to be covered under that group plan. The easiest way to opt out of Part B is there's going to be a form that'll come with your Medicare card. Check on the back, I don't want medical insurance, sign it, send it back. Then Medicare will send you a new Medicare card that says, I just have Part A only. All right, the second part of this webinar, Part 2, what does Medicare cover? This block diagram is really what I'm going to use throughout this webinar. It shows you the big picture of Medicare. The only thing that's being provided to you by the federal government is up in the upper left, Part A and Part B of Medicare. Everything else, Part C, Part D, Medicare supplement insurance, everything else is provided by a private insurance company. And that's where I fit into the conversation. I am an insurance agent. I'm an independent insurance agent, which means I'm not an employee of an insurance company. Rather, I represent you instead because I represent many different insurance companies, and I can help you shop and find whoever's got the best rate for the different plans in your area. So now let's look at Part A specifically. Part A of Medicare is your hospital insurance. And we're going to start off looking at everything by just looking at original Medicare Part A and B. We're going to bring in the supplemental insurances into the conversation in a bit later, but let's just look at what original Medicare Part A and B cover by itself. Part A is your hospital insurance. It's only going to apply once you become admitted as an inpatient to the hospital. Every month, there is what's called a premium to pay for health insurance. So a premium is just something that you owe every month. However, about 99% of Medicare folks, almost everybody, qualifies for premium-free Medicare Part A. That just means you don't owe a monthly premium for Part A. As long as you've worked for 40 quarters, as long as you've worked for 10 years or more, and you've paid out a small amount of your paycheck out toward a Medicare tax, that entitles you to premium-free Medicare Part A. If you don't have those 40 quarters, that 10 years of credible work history, you can often qualify for premium-free Part A from a spouse's record. So if that applies to you, look into the option, or even give me a call and email me. My contact info will be at the end of the webinar here, but we can look into whether or not you can qualify for premium-free Part A if you don't qualify for it based on your own record. All right, most people pay nothing every month for Medicare Part A. However, Part A doesn't cover everything. So a deductible, kind of again to define insurance terms, a deductible is something that you have to pay before the insurance technically kicks in. So the Part A deductible is something that you'd have to pay before Medicare would cover your hospital stay. This year, in 2017, the Part A deductible is $1,316. That means if you are admitted to the hospital, you come up with that amount before Medicare pays for the rest of your Part A costs. Paying the $1,316 will cover you for what's known as a 60-day benefit period. If you're in the hospital for longer than that, we're not going to really get into those costs, but if you go into the hospital right off the bat, if you just had Medicare Part A and B without any secondary insurance, you're going to pay $1,316. That's going to cover you for a 60-day benefit period. So to give you a couple examples, let's say you get pneumonia. It's bad enough where you need to be hospitalized. You're in there for 2 or 3 days and you feel, good enough where you can come home and they release you. And let's say you come home and you're home for a couple more days and you don't feel right. You go back into the emergency room and they readmit you to the hospital. Well, in that case, you're still covered under your 60-day benefit period because it hasn't been 60 days. That 60-day benefit period starts your first day of care. So you don't have to pay the $1,316 again to be hospitalized. However, if you are released from the hospital, then 4 months later you break your leg because you fall and you slip on the ice. It's in the wintertime, you're shoveling your driveway, and you have a really bad fall, and they admit you to the hospital. In that case, 4 months later, it's more than 60 days later, then you're going to have to meet that deductible again. You'd have to pay that $1,316 again. The other thing that falls under Part A is what's known as a skilled nursing facility. Another name for it is rehab. Another name for it is your post-hospital stay. So the rule is Medicare will pay for the first 20 days of a skilled nursing facility, assuming you're hospitalized for 3 days or more. If you're not hospitalized for 3 days, Medicare is not going to pay anything. But once you're hospitalized for 3 days or more, Medicare is going to pay the first 20 days that you're in this post-hospital stay. And a post-hospital stay is kind of, the doctor says, well, you don't need to be hospitalized anymore, but I don't want to send you home just yet. Let's go to this skilled nursing facility, get better, and then we can go home hopefully in a few weeks. In that case, Medicare is going to pay for the first 20 days, and then days 21 through 100, if you happen to be in that skilled nursing facility for more than 20 days, you'd be responsible for paying $164.50 as a daily copay. All right, now Part B. Part B is most of what you're going to use Medicare for. It's going to be your tests, your treatments, your procedures, your doctor's visits. Medicare always uses the term medically necessary. So anything that's medically necessary is going to fall under Part B. Even during a hospital stay, Part A only really applies to kind of your room and board, your nursing services, your bed, some of your medications. Part A only really covers the facility costs where you're hospitalized. So if you need tests while you're in the hospital, if you need surgery, anything doctor related, any tests or treatments related to a hospital stay, either while you're hospitalized or even, as an outpatient, blood work, CAT scans, all that sort of stuff is going to fall under Medicare Part B. So we mentioned how the Part A premium, almost nobody pays a premium for Part A. However, everybody pays a premium for Medicare Part B. New folks to Medicare will pay $134 a month. So anybody new to Medicare in 2017 will owe $134 a month. Now there are some exceptions, people that make, a lot more income can owe a little bit more, but your general Part B premium, your standard is to pay $134 a month. Now this number might seem a little bit high. Maybe your neighbor or your sister says, oh, I only pay, let's say $120 a month for Medicare, or I only pay $110. Well, just keep in mind that people that signed up for Medicare before 2017 will be paying less for Medicare. And it's because of a special rule called the hold harmless provision. Not going to get into it. It has to do with annual increases in Social Security income. But just keep in mind, if you sign up for Medicare, you're new to it in 2017, your monthly premium is going to be $134 a month. The Part B deductible is $183 for the year. And comparing that to the Part A deductible, which was for that 60-day benefit period, the Part B deductible is for the year. So it starts over every January 1st, and your total deductible for this year for Part B is $183. Another gap in Part B is the 20%. And that's what a lot of you have probably heard. Oh, I need something to help pick up the 20% that Medicare doesn't cover. So technically, You're responsible for paying the first $183, that Part B deductible. After that, Medicare pays 80%, you pay 20%, which is known as the Part B coinsurance. And the reason that you need supplemental insurance to cover the 20% is that there's no limit on how much that 20% can be. So if you have a 2-week stay in the hospital because you're in ICU, if you need surgery, and you have a $500,000 medical bill, Part B medical bill, well, Medicare is going to pay 80% of that. They're going to pay $400,000, but that other $100,000, that other 20%, you're responsible for coming up with yourself. That's the biggest gap under Medicare. That's the biggest reason that you need secondary insurance. All right, now we're going to get into the types of secondary insurance. We've kind of gone into where the gaps in Medicare are. Now let's show how to fill those gaps and get you covered. So if we look at this overall big picture again, we can see that you have what I like to call a fork in the road. There's a path on the left, there's a path on the right. You can only go down one plan. So since we started off with the path on the left, and we explained Medicare Part A and B, we're going to stay with the path on the left, and we're going to jump down to the bottom, and we're going to look at Medicare supplement insurance. This is a chart of the different Medicare supplement insurances that are offered. Medicare standardizes these plans. So what that means is a Plan G, for example, you can look at from top to bottom, is the same exact plan no matter what insurance company it's offered by. But we're going to get into that later. So this chart might seem a little confusing, but we're going to break it down and we're going to make it understandable so it makes sense and you're able to kind of figure out what it's telling you, which is important. The column on the left under benefits are basically your cost shares. They're your responsibilities under original Medicare Part A and B. And we've already covered a lot of those. We've covered the Part A deductible. That's that $1,316 that you'd owe if you were hospitalized. We've talked about the Part B deductible, which is $183. We've talked about the Medicare Part B coinsurance, which is the 20% that you're responsible for. So basically, your liabilities under Medicare are listed in the column on the left. Now we can see that there's about 10 letters, which represent 10 different MEDIGAP plans. So the way to read this chart is if a particular letter plan that we can look at from top to bottom has 100% in the box for a particular Medicare benefit, a particular liability under Medicare, it's going to pay 100% of your liability under original Medicare, Part A or Part B. Some of the boxes here have 50 or 75% and whatnot. I don't like to talk about those plans because they leave thousands of dollars of out-of-pocket expenses still left that you'd be responsible for, so I'm not even going to mention them. The plans I'm going to talk about, the most popular ones are Plan F, Plan G, and Plan N. So if we look at Plan F, it's in the middle of the page from top to bottom. We can see that there's coverage in every single box. The only thing that's not 100% is the foreign travel benefits listed there at the bottom. Just to kind of quickly cover that, if you go outside of the US, Medicare doesn't cover you. However, the Medigap plan will pay 80% up to certain benefit limits. But everything else is going to have 100%. So as long as you're treated in the US, you see a doctor that takes Medicare, and you have whatever you have done is medically necessary, Medicare is going to pay its part, Plan F pays its part, because it's going to pay 100% of where Medicare leaves off. So let's dive a little bit deeper into Plan F. Because it covers everything, it's the simplest plan to understand because it does cover everything. Whatever Medicare doesn't pay for, Plan F will pay for. Plan F is the most popular Medigap plan if you look at what people are enrolled in across the country. However, in almost no circumstances is it the best plan for you. There's a couple different reasons for it. I'll tell you that insurance companies charge a monthly premium for a Medigap plan based on how much it costs them, how much they have to pay out in claims, in medical claims when people file claims when they have their plan. They're going to have to pay out the most. Insurance companies are going to have to pay out the most for Plan F for a couple different reasons. The first reason is that Plan F is it's known as a guarantee issue plan. So if we think back on the chart that we looked at, how there was about 10 plans that they were offered, about half of those plans are guarantee issue plans. What that means is when there's certain situations that happen where people lose their coverage, in certain situations where someone on Medicare needs to get a Medigap plan, Plan F is guarantee issue. And that means that you can get Plan F, no questions asked. Now, that doesn't apply to when you're first on Medicare like you are now, but down the road, if you lost coverage for a certain reason. So one of the examples I'll give is General Motors and Ford, two car companies, back around 2008 and 2009, said to all their salaried retirees, okay, we're no longer going to provide your health care for life. Now, we're taking that benefit away. Instead, you now have to go out and get your own Medicare supplement insurance. Now, we're going to give you a little bit of money every month to go out and find your own, but you have to now take that responsibility, go find your own plan. That's one of the guarantee issue situations. So anybody in that situation that was a retiree of General Motors, for example, a General Motors salaried retiree could get any Medigap plan if he wanted and get that plan, no questions asked. However, another plan like Plan G, which we'll talk about in a second, if he wanted to get Plan G, he would have to answer health questions. So what does that mean? Well, Plan F being a guarantee issue plan is going to take more people. And it's going to take more people that have more health problems that are less healthy. That's going to result in the insurance company paying more in claims for that less healthy pool of people that have that plan, and rates are going to go up a lot faster as time goes on. Just during this past year, I came across a retiree of one of the auto companies. They had the original Plan F that they got about 8 years ago. When they first lost their coverage, they're paying more than $200 or $300 more than they would have if they would have gotten Plan G, just because everybody that got Plan F, so many of those people were in bad health, filed a lot of claims. The insurance company stopped offering that plan, and the only people that were left in that, well, the majority of the people that were left in that plan started filing a lot more claims than other companies and other plans. So it made a huge difference in the way these monthly rates went up going down the road. The second reason that you want to be careful with Plan F, and that I just generally don't recommend it anymore, is that folks that are new to Medicare, starting in January of 2020, you can no longer get Plan F. So you're saying, Chris, well, I'm turning 65 now. Why does this matter? It matters because, going again back to the concept of insurance companies charge their premium for their plan based on the amount of claims that they have to pay. So think about what happens when people can no longer get your plan starting in January of 2020. Let's say you decide to get Plan F now. In a few years, new, younger, 65-year-old Medicare folks can no longer get your plan. So what's going to happen to the people that have Plan F with your company? They're going to get older, they're going to file more claims, and the rates with your Plan F are going to go up faster than other plans like Plan G and Plan N that don't have this January 2020 restriction. So that just means as the people that have Plan F get older, going to file more claims, going to pay more premiums. Again, your premiums are going to go up faster with Plan F than they would with other plans. So let's just compare that to Plan G. Plan G is just listed right next to Plan F. You can see that there's only one difference between the two. The only difference is that Plan F pays your Part B deductible because it's got 100% in that box. Plan G, you'd be responsible for paying that deductible yourself. So I like to call Plan G the most cost-efficient plan. If Plan F is the most popular, I call Plan G the most cost efficient because your Part B deductible is your downside. As long as you see a doctor that takes Medicare, have something done medically necessary, the most you're going to pay out of pocket for anything Part A, Part B related is going to be $183 for the year. Now that amount can change a little bit, and it does change a little bit for, year after year, but what you're able to save in monthly premium is going to more than make up for that Part B deductible. So if we look at an example comparing Plan F to Plan G in Fraser, Michigan, it's the zip code, it's where I grew up. So if we look at somebody turning 65, if you're, a gal, you're turning 65 in the zip code, the best Plan F that you can get, the best rate is $143.19. The lowest Plan G premium you can get is $119.15. You can see that's a difference of about $24 a month. For the year, you're going to save almost $300 for the year in premiums. And then what's the worst case that can happen to you? You have to pay a $183 deductible, so you're still going to end up more than $100 ahead. And if you don't go to the doctor very much, if you maybe only have an annual physical that year, you might not even have to pay the $183 deductible. You could pay less. And as you get older, that gap might not be $24 a month. Maybe in a few years, maybe it's $34 a month. So again, as you get older, Plan G is going to always be a more cost-efficient way to provide your Medigap coverage compared to Plan F. So the third plan I like to highlight is Plan N. And there are a couple differences between the plans that we talked about and Plan N. Again, kind of giving names to them. I like to call Plan N the most economical plan, because your out-of-pocket expenses now are the Part B deductible, the $183 deductible like you'd have to pay with Plan G. The next biggest difference with Plan N is the only Medigap plan that has copays. Copay just being something that you're responsible for paying at the time of your doctor's visit. So at most, whether it's a specialist, whether it's your primary doctor, at most you're going to have to pay $20 for an office visit. And if you happen to go into the emergency room, you could pay $50 for an emergency room copay. Still probably not too bad comparing to whatever coverage you do have now. I think with my plan that I have that I'm covered under, I either have a $250 or a $500 emergency room copay. So $50 is still pretty reasonable. The other thing that you have to pay with Plan N is something called Medicare excess charges, but I'm not even going to talk about those because as long as you see a doctor that accepts Medicare's billing amount, you don't even have to worry about them. But just kind of be aware that they are there. So now, how do you find the best Medigap plan? If you decide to go down this path on the left, if you will, the best way to do it is to use an independent agent that represents many different insurance companies. Again, I don't work for an insurance company. I don't have their best interest at heart. I have your best interest at heart because I help you find the best plan. If I don't find the best plan for you, well, you're probably not going to be a client of mine very long because you're going to find out you can get a better deal with somebody else and you're going to leave and you're going to go with a different company. So the better job that I'm able to help you find the best deal, you're going to remain my client. And another thing, prices are hard. They're hard to find on your own. Maybe some of the things that you're getting in the mail are going to list and are going to tell you what your premiums are, what they're charging you for their different Plan F and Plan G and so forth. But usually you're going to have to call up each individual insurance company, find out what those prices are, and then do all this homework to find the best plan. So it's really best to use an independent agent, and we're going to go over the reasons to use an agent. I don't charge a fee for my service. You pay the same thing whether I'd help you find a plan with a particular company than if you'd go direct. So there's many reasons to use an independent agent, which we'll talk about at the very end. But this is just kind of a highlight on how to find the best plan for yourself. Okay, you remember that we went straight down to the bottom on the path on the left and talked about the Medicare supplement insurance. Now we're going to talk about the part we skipped over is the standalone prescription coverage. Because the Medicare supplement insurance only works with Part A and B of Medicare. It only helps fill in the gaps of the doctor and hospital type of coverage. Now you need to get a separate plan that covers your prescriptions alone. And there's really two ways to find the most cost-efficient drug plan for your situation. So your situation being whatever medications you take, whatever pharmacy you like to go to, and your zip code. So the best ways to find the most cost-efficient drug plan is first to use the Medicare Plan Finder on the Medicare website at medicare.gov, whether you do it yourself or I can help you walk through the process. Or if you call 1-800-MEDICARE, they can analyze it for you. Generally, they like you to call the month before you're turning 65 so they can do it for you the month before. Again, I've created a little demo on how to use the Medicare Plan Finder. So let's watch that demo, and again, we'll kind of come back to the live webinar after that. So the best way to find the most cost-efficient drug plan is just to go to medicare.gov and use their Plan Finder. And to get into that tool, you just want to click the green Find Health and Drug Plans button. On the next screen, we'll use the general search option, and in the zip code box, put in your zip code and click on Find Plans. On the next screen, you'll have a few options. Choose the original Medicare option and the I don't get any extra help option. Folks that get extra help, that's called low income subsidy. You would get assistance on the premium for your drug plan as well as some of the co-pays. Most people don't fall into that situation, so unless you know you do, just choose the default of I don't get any extra help, and then just choose original Medicare. Don't put any other information in there. The next screen, we'll scroll down a little bit, and it'll give you the option to enter in your drugs one by one. We'll put in a couple common ones, like metformin is a drug that I see a lot for diabetes. It'll bring up the defaults in there, and here it's a 500 milligrams. Quantity is 60, and that's a quantity every month, so basically somebody that's taking that twice a day. Another common drug that I see is levothyroxine. And again, we'll just go with the default that it brings up. And a third drug we'll put in there is timolol. And the best way to choose the amount is to estimate how often you go through a bottle. So if you had this drug, you'd take a look at the bottle and see how big it is, whether it's 5 milliliters, 10 milliliters, or 15. You would want to know if it's what percentage solution it is, and then put in there how many packages you get. So if you go through one 10 milliliter bottle every month of timolol, and it's, let's say, 0.25%, we would just choose that one. Whenever that drug list is done, we'll choose My Drug List is Complete. And next you want to put in pharmacies. You can choose up to 2. And to expand your selections, we can just expand the radius around where we live. Let's say you go to Costco, and let's say you also go to CVS. Generally, the specific stores don't matter as long as you just pick that pharmacy. That should be enough. And we scroll down to the bottom, click on Continue to Plan Results. The option we want to pick to find the most cost-efficient standalone drug plan is just to check off this first option. You can see in the zip code that we picked, there's going to be 23 plans available, and this is for the 2017 year. And you can see the results come up here now, and these are the 23 plans that are available in this zip code. What the results have done is they've sorted them by this number, this annual number. The annual number is a combination of the monthly premium every month for all of 2017, as well as all the co-pays that you'd pay throughout the year. So the plan that it puts at the top is the most cost-efficient one based on your zip code, based on the pharmacies you put in, and based on the medications you're taking. So you can see this number of 211 is obviously the lowest. The second best one would be this WellCare Classic. 349 would be the total for the year. and then $438 would be for this Aetna plan, Humana Walmart would be $498, and so forth. And this is sorting it by lowest estimated annual retail drug cost, which means going to getting it at the pharmacy. If you prefer mail order will often let you get it for a lower cost throughout the year. So if we choose that option and hit sort, now can see this Envision is still the best one. It's the most cost-efficient one based on those 3 medications. And now it's sorting it by mail order, which is the $199 as opposed to this annual number, because you can see Humana Walmart now is the second best plan of an annual total of $204, where if you went to get them at the pharmacy, you'd pay a lot more because it'd be close to $500 total for the year. So now we can actually click on the plan name and get more details. It'll break it down into a lot more detail so we can get an idea of what our cost shares are and how much to expect to pay when we fill our medications. Here's just a recap of how much the premium is, $1460. This plan has a $270 deductible. This is showing the annual recap. If you went to Costco, this particular plan would run you the $211.20 for the year. CVS would run you a lot higher, and generally what's happening there, every drug plan will usually use standard pharmacies and preferred pharmacies. If you go to a preferred pharmacy, you get preferred pricing. So my best guess is with this plan, Costco is a preferred pharmacy. CVS, you're still covered, but you're going to get standard cost sharing instead. And mail order is going to save you a little bit over the course of the year, but just not a whole lot. If we scroll down and see the first column here, the full cost of the drug is actually the annual retail, it's the retail cost of the drug every month. You can see the frequency here is every month. And this shows you what your copays are, both in all 4 phases, in the deductible phase, the initial coverage level phase, and so on. And notice we can change the tabs here at the top. So we saw above that Costco was the lower cost pharmacy. If we chose CVS, we can see how much more expensive those costs actually get. And mail order is going to show us results for getting them 3 months at a time instead of 1 month at a time. So if we go back to Costco, we can see that the deductible phase, we're only owing $1 for each of our medications, $3 a month. And that's now shown in the budgeting tool below it, where $1460 is the premium every month. So kind of the gray part of that bar is how much we would spend in premium every month, and then the rest of it is the $3, which is the copay every month, and it's color coded down here where it shows the orange is what you'd pay in the deductible phase. And it's basically a budgeting tool, because if we total up these $18 payments or expenses throughout the course of the year, 18 times 12, it's going to be a little bit over 200, and that's where we get this total cost of $211 over the course of the year. Again, if we switch back over to mail order pharmacy, now we can see that we're filling our drugs every 3 months instead of every month, and it lowers our costs throughout the year a little bit. One thing to point out, it's not an issue with the 3 medications we put in, but sometimes drugs have limitations with different plans. There are things called prior authorizations, quantity limits, step therapy. Each of these blue question marks, if you click on them, it'll open up a window where it'll give a definition. If you do have restrictions there for any of your medications, click on that box, read what that restriction is about, because sometimes there's going to be hoops for you to jump through, or potentially your plan that you're looking at signing up for will not let you sign up for that particular or get that particular medication because there's going to be restrictions, and they'll often make you use a different medication before the drug plan will actually make you use a different medication for a particular symptom or a particular condition before they'll actually cover the medication that you want to use. So anyway, make sure that you follow up on those restrictions. Okay, so that is pretty much how to use the Medicare Plan Finder. If you go back to the previous page, it shows your results again, and like I mentioned, you can sort different ways. Each of the plans are going to have different premiums, different deductibles, but basically this Plan Finder is just showing you
what's going to be the most cost-efficient plan based on your medications and based on where you prefer picking them up at the pharmacy or through the mail.
All right, we're at part 4. We're going to talk about Medicare Advantage plans now. So we've talked about this fork in the road. We've completed talking about the path on the left. We're now going to talk about the path on the right, which are Medicare Advantage plans. Let's look at the basics of Medicare Advantage plans. Since we talked about Part A and B of Medicare, and since we talked about Part D of Medicare, didn't really talk about the penalties for not enrolling, but if you're eligible to enroll and you decide not to, there are late enrollment penalties for not enrolling in those other parts of Medicare. However, Part C is optional. There's no late enrollment penalty for not enrolling in Part C. And just looking at the chart, if you decide to go down the path on the left, you're not enrolling in Part C. Another thing is whatever path you go down, you still need to have original Medicare in place. So you still pay your Part A and your Part B premiums. You'll still owe those premiums. But often the Medicare Advantage plans will have a separate premium too, like MEDIGAP plans. So there's some plans that are available for very little premium, but most of them are going to have an additional premium. Excuse me, most of them are going to have an additional premium that's left to pay for actually having that plan, which, more than makes sense. To sign up for insurance, you're going to expect it to cost something else. If we look at the way Medicare Advantage plans work, even though you still need to pay for Part A and B of Medicare, what happens now is you're actually temporarily disenrolled from original Medicare if you sign up for an Advantage plan. Now, that's not a good thing. It's not a bad thing. It's just the way it works. Because the way Medicare Advantage plans work is once you sign up for an Advantage plan with a particular insurance company, that insurance company is completely responsible for your care. So what happens when you sign up for their plan, Medicare now gives that insurance company about $10,000 a year. And they're responsible for providing your health care. So Medicare effectively has no responsibility for providing your health care anymore. They now give money to an insurance company. That insurance company is completely responsible for providing your managed care, and they set the rules on your plan. Excuse me. They tell you how much to pay when you use their coverage, what your copays are, what your deductibles are, what your maximum out-of-pocket amounts are. But they set the rules. Now, keep in mind that Medicare has to approve what rules they set, but they're responsible for providing your care. So if you get a Medicare Advantage plan, you actually don't even need to show your Medicare card when you check into the doctor or you check into the hospital. You just need to show that one Medicare Advantage card, your one Medicare Advantage plan card. If we look at how some of these plans differ compared to the other plans we talked about, Medicare Advantage plans require you to stay within a network. Before we talked about original Medicare with a Medicare supplement, as long as a doctor takes Medicare, they're going to take whatever supplement you have. It's a requirement. But if you have a Medicare Advantage plan, you have to stay within the network. So whether your plan is a PPO, whether it's an HMO, you're required to stay within their network. Now, if you have an HMO, you're generally not covered if you go outside of that plan's network. An exception being if it's an urgent situation, if it's an emergency room, you still can be covered. But if you're traveling out of state and you just want to see a doctor, you want to have surgery done in another state because, let's say there was a specialist in a different region that somebody recommended to you, if you have an HMO, you're likely not going to be covered. If you have an HMO, what's called POS, point of service, or if you have a PPO, you do have some additional options to be covered outside of your main network. However, you're going to pay a higher amount to be able to use those doctors. Another thing to keep in mind with an HMO, you generally have to get a referral if you want to see a specialist. With PPOs, you don't. With original Medicare, you don't. But if you have an HMO, Medicare Advantage plan, you'll often need a referral if you want to see a specialist. Some more disadvantages are that your potential out-of-pocket expenses are much, much higher with a Medicare Advantage plan. Also, you'll pay some sort of cost share every time you use your plan. Now, if you just need a general yearly physical, there's going to be a lot of preventative tests that Medicare is going to pay at 100%. So your Medicare Advantage plan will not charge you a copay or to meet a deductible to get those done. They'll be provided free of charge. But other than that, every time you have a doctor's visit, every time you have a test done, blood drawn, every day in the hospital, every day in a skilled nursing facility, you're going to have something to pay. You're going to have an out-of-pocket expense, and those costs can get expensive. Usually the amounts for your maximum out-of-pocket amount in any given calendar year, and again, it'll reset the next January 1st, you're going to have roughly $3,000 to $10,000 in a maximum out-of-pocket amount to have to meet. So if you have a bad health year, you could be looking at several $1,000s and having to pay out of pocket if you're kind of now managing a chronic condition. Now compare that to getting a Plan G, where we talked about you got a $183 deductible to meet, and that's it. So just looking at your potential out-of-pocket expenses, your Medicare Advantage plans can get very expensive. But why do people sign up for Advantage plans? Well, some of the advantages are the Medicare Advantage premiums can be a lot lower than getting a Medigap plan with a standalone drug plan. On average, your Medicare Advantage premiums are going to be lower than going down that path on the left. Also, many Medicare Advantage plans will have some routine vision, dental, and hearing coverage built into the plan. So original Medicare doesn't cover anything routine for vision and dental and hearing. Now, if it's medically necessary, if you need cataract surgery, for example, or if you need, if you have glaucoma, or if you're diabetic and your eye doctor needs to make sure your eyes are still healthy, those costs are going to be covered by Medicare because they're medically necessary. But just to get a new prescription for your lenses, to get new frames, to have your teeth cleaned, that's where Medicare draws the line and they just don't cover it. But a lot of Medicare Advantage plans will throw in basic coverages. Preventative dental, like your cleanings, your oral exams, or maybe a set of x-rays every couple years. Or for vision, maybe they'll give you, they'll cover one eye exam every year, or maybe they'll pay a little bit toward if you needed a new set of glasses. But just keep in mind, anything beyond preventative for Medicare Advantage plans is generally not going to be covered by the plan. You're going to have to pay for that out of pocket as well. So that really kind of covers what your two main options are. So if we look at this chart, kind of look at the big picture again, let's just take a look at the pros and cons about going down each side. On the one side, on the left, you're paying a little bit more for your coverage, but your out-of-pocket expenses are much, much less if you use your plans, and your freedom to be able to see anybody you want to. Going down the path on the right, now you're going to save a little bit in monthly premium, but you potentially could get stuck with a much larger several $1,000s out-of-pocket expense every year. You're confined to staying within their network, but they do give you, in addition to a lower monthly premium, they do give you kind of your benefits to your routine dental and vision coverage, and even sometimes hearing coverage too. So going back to what I was saying before, you are truly going to be best off using an independent agent. Plans are based, like I mentioned before, on your zip code, on your age, on your gender, and in some states with some companies based on if you use tobacco. So plans are going to vary greatly depending on where you live. If you just compare folks that live in South Carolina to folks that live in the upstate of New York, MEDIGAP plans, for example, are more than 3 times as much in New York as they are in South Carolina. So it makes a big difference in finding somebody that's able to represent many different companies in your region and help you find the best plan. So again, an agent can help you find the best plan for you based on what your healthcare needs are and what your monthly budget is. If you choose a Medicare Advantage plan, decide that path on the right is best for you, you want to use an agent who knows the local market. The thing that's the most important, in my opinion, with a Medicare Advantage plan, you want to make sure that your doctors accept it. Your cardiologist, your primary care doctor, whoever that you need to see, it's important for your health care. Make sure they take the plan you're thinking about signing up with. Even your local hospital, make sure your plan accepts it. So you generally want to find a local agent you can see face to face that's going to know what companies participate with what hospital networks, that participate with what doctor networks, and make sure that you're going to be able to use your coverage where you want to use it at. But if you decide to choose a MEDIGAP plan, you want to use an independent agent. An agent that can offer any insurance company that's out there. You don't want to work with a captive agent who is an employee of an insurance company, because they're only going to be able to offer you those plans that are available with that one company. And very rarely, if you decide to call up even a big name reputable company, it's probably a pretty slim chance that that company is going to be your best deal in finding the best plan for you. And the reasons that you want to use an independent agent. Now, I'm comfortable with shopping for car insurance on my own. I'm kind of a do-it-yourself person, so why do I want to use an independent agent? And you might be saying the same thing. Well, there's going to be 4 reasons. First of all, like we've kind of shown, an independent agent can find you the most cost-efficient plan when you first get on Medicare. They can help keep you in the most cost-efficient plan as prices change, as rates change, as things change down the road, which they're absolutely going to. That's one thing you can be completely confident in, is that Medicare is going to change, plans are going to change. I have my pulse on the Medicare industry, the insurance industry when it relates to Medicare products. So I'm going to be able to give you a call 2, 3, 4 years down the road and say, hey, I think it's going to make sense, Bill, Alice, it's going to make sense to switch. You can save $20, $30 a month. If you go direct to the insurance company, they're not going to call you and say, you know what, if you switch to this other insurance company, you can get this exact same plan for $40 a month. That's just never going to happen. So using an independent agent, and even if that agent doesn't reach out to you, it's always somebody that you can reach out to and say, Chris, am I still in the best deal? Let's do an annual review. Let's make sure I'm still in the best plan I can be in for my situation. Independent agents like myself can also provide one point of contact. So rather than calling a large insurance company that you could call during the annual enrollment period in the fall and easily wait on hold for an hour and then end up talking to somebody in another country that can barely speak English, you can call an independent agent, talk to the same person every time that knows your situation, that can go to bat for you. And that all sounds great, right? But what does it cost? It doesn't cost you anything, because I don't charge a fee for my services. Complete transparency. I get a small commission from whatever plan I'm able to help you get set up with. Whatever type of plan it is, whatever company you go with, I'm agnostic. I'm going to recommend what I think is best for you in your situation. I'm going to give you a couple of choices, but in the end, I don't care what plan you sign up with, because it's your choice. And whether you went direct with that company you decided to pick through me as your agent, or whether you went direct to the insurance company by either applying on their website or by calling them up, it's the same price. So I'm able to help you shop the market, find the best plan of what you're looking for, get you enrolled, work with you on an annual basis. So maybe it doesn't make sense to you that, well, why am I not paying more by going through you than if I went to the company directly. There's got to be a catch. If there is, I haven't found one yet. In my industry, I've found that you don't want to do what the insurance company wants you to do. You typically want to do the opposite of what the insurance company wants you to do. The insurance company would rather you sign up directly with them, because then they don't have to pay me a commission, because they're getting the same premium whether you sign up directly or you sign up through me. But like I mentioned before, I don't work for an insurance company. I'm representing you. So it really is in your best interest to use the help of someone like myself, because it benefits me. It's how I make my living. It benefits you. You're able to maintain the best possible coverage. So I'd just like to thank you guys for those of you who have stayed around till the end. I know I've kind of gone on for a while, but we covered a lot of material, and I appreciate those of you who are still with me. Just want to say that even if you don't become a client, I hope you found a lot of value in this webinar. My job is really just to give you as much value as possible, whether you're a client or not. So hopefully you found it helpful. You'll notice at the bottom throughout this webinar, I've given a number and also invited you to text the word Medicare to that number, to 310-340-7228. If you do that, I'm going to text you a link of how to get an appointment set up with me. You can pick a time in my calendar that'll work best for you. So if you're interested in your free consultation discussing your situation with me, go ahead and text the word Medicare, again, to 310-340-7228. I'm also going to include my phone number and my email address in case you just want to reach out to me directly, and not have to worry about scheduling an appointment. That way you can call me at your convenience. So I'd appreciate the opportunity to help you guys. I'd love to be able to have you as my client and serve you for years to come. So hopefully I hear from you soon, but otherwise just stay healthy and stay safe. Take care. So like I just said, I just want to thank you guys for those of you that have stayed around till the end of this webinar. If you're looking at kind of the next steps to take, after this webinar, you should have a pretty good idea on how Medicare works. Now that you understand Medicare, it's really important that you understand how things work in order to make a decision that you're comfortable with. The second thing is now that you've watched this, you should have a pretty good idea of what plan you want to get, which plans you're leaning toward. Kind of the third piece in the puzzle now is to get quotes. And that's really where I fit into the picture. I can provide you quotes on the different types of plans that you're looking for. So once you understand Medicare, once you know what plan you want, once you know what the quotes are, now you have your decision made. And really the last piece in the puzzle, just finishing everything up, is filling out the paperwork, filling out the applications. And again, that's where I can help you out. Fill out all the paperwork for you, just get the information from you to cross the T's and dot the I's and to get everything done. So give me a call or send me an email and let's get everything wrapped up. Okay? Sound good? We'll talk to you soon. Thanks.